On January 1st, 2014, there was a total of 14.5 million living Americans affected by cancer. Cancer can be defined as a group of diseases characterized by a collection of uncontrolled growth and spread of abnormal cells. Based on data collected during 2011 through 2013, there will be approximately 39% of men and women diagnosed with cancer in their lifetime.
In 2016, Cancer.org estimated that there will be 1,685,210 new individuals diagnosed with some form of cancer. Of that, 43,190 will come from Virginia.
Cancer has become one of the leading causes of deaths within the United States. The National Cancer Institute reported that there are nearly 100,000 cancer deaths yearly, leaving the financial burden to families. Arising the question to many families, how will we handle the cost?
Well, here's the answer. If granted the opportunity, we would create a nonprofit organization titled Case Cancer. Case Cancer is a new initiative under SNPhA for the 2016-2017 academic year. The mission statement for Case Cancer is to bring awareness to our local community on the prevalence and non-prevalence of cancer through education, service, and broad development. The overall goal is to alleviate financial burdens for families right here in the Hampton Roads area.
Introduced by two students who each had a family member experience the battle with cancer, it has become our objective to aid in their stance to help end the fight. Where we believe as a chapter, things get solved when pharmacy students get involved.
Case Cancer, LLC, will be our way to give back to join together for our community by providing financial assistance, support, and education to family in need. According to the Kaiser poll, 72% of Americans believe that cancer cost is unreasonable.
In 2010, my father was diagnosed with colon cancer. At the time, my family did not understand how our lives would change drastically. In 2012, my father entered into the hospital with over $15,000 worth of medical bills. 2 weeks later, that number doubled. We had our medical bills, a mortgage, my education, along with funeral costs. As a previous United States Air Force service member, they assisted with the funeral costs. 4 years later, we are still working to pay off the medical bills. Cancer is not an individualized diagnosis. It not only affects the patient, it also affects the family members.
The health cost of a diagnosed cancer patient has doubled over the past decade. The average cancer treatment cost is estimated to be over $10,000 per individual. In total, over $895 billion annually will aid towards cancer treatment.
The starting of this nonprofit organization will become a major objective in our chapter by aiding in our goal of giving back to changing healthcare in underserved communities. It is pivotal that we focused on helping cancer victims and their families by using a 7-step approach in order to make this a success.
This nonprofit organization will be an ongoing project for our chapter. With the assistance of Walmart Sam Club, we will submit the paperwork to incorporate Case Cancer, file the 501c, and submit the Virginia Charitable Registration. With advertising for the organization, initial donations to families, and workshop material, the cost for this effort will total in $2,500. Right here at Hampton University, the school is making strides to assist with cancer patients by offering numerous of treatments through the Hampton University Proton Therapy. We will partner with these resources to help end the fight.
Having a younger brother who's a cancer survivor, I was able to witness firsthand how the medical bills took a toll on my family. Cancer itself is already a hard enough pill to swallow. So if we can alleviate some of the financial burdens that these families have, we'll feel like our job as future health practitioners is done.
Our experience alone has created a platform for this service. As a daughter of a cancer victim,
and as a brother of a cancer survivor, we must be the voice.
We can make a difference.
We will be the change.